Hey there, I have a question. So, when you were growing up in a typical Kenyan home like I did, you went to hospital, you perhaps had your diagnostics of your illness or something of the sort written down in that piece of, used to be yellow I think, some piece of paper, some piece of a booklet that you used to pay, I don't know, 60 shillings to get at the healthcare facility. Can I ask an honest question before we have the tech news of the week? Can you still trace that book? If you can't, welcome to TECHOVER, because we'll be talking about digital health records. My name is Brian Jodetieno, NTV's in-house techie. You're right on time for the biggest tech conversation in Africa. Let's start with the tech news, and then we have this impressive guest to talk about digital health records. This week, we focus on the home internet market. The last 1 week, Kenyan tech space has been awash with conversations of Starlink's home internet disruption. Kenya's biggest telco, which also holds the biggest home internet market share, asked the Communications Authority (CA) to block satellite internet providers with operations in other countries. The move could lock out Elon Musk-owned Starlink, which has seen increased adoption due to promotions and cheaper monthly plans. Safaricom said that it proposes that CA instead considers mandating satellite providers to only operate in Kenya, subject to such providers establishing agreement with an existing local licensee. Safaricom asked the regulator to assess the risks of allowing satellite internet providers to operate without an agreement with local companies. The telco said allowing satellite ISPs to operate without a physical location would make it hard for the government to regulate their operations. It also suggested that the regulator assesses the risk and ensure that satellite providers operate under the license of a local company to maintain control and accountability. In what can be considered pushback against this proposal, analysts hold that Kenya risks incurring the wrath of American government by attempting to block Elon Musk's Starlink satellite internet service from expanding in the Kenyan market at a time when Nairobi is negotiating trade pacts with Washington. Starlink's growing popularity has pushed existing local players to increase marketing to retain customers. Safaricom, which had talked about launching a satellite internet service, has a firm grip on the data market with a 36.7% market share. Safaricom also came out to debunk a rumor that it had blocked M-Pesa payments toward Starlink. Moreover, in Kenya, Starlink, which launched in the country in July 2023, has introduced a new rental kit option, allowing customers to rent the hardware, an option designed for those who cannot afford to purchase the kit outright. Meanwhile, Safaricom has reportedly lowered its internet pricing to win back customers who had switched to Starlink. While regulation and compliance have been significant setbacks for Starlink's launch in some African countries, others that initially banned the internet service provider have since granted it licenses and approved its launch. Recently, Starlink launched in Botswana after a year-long regulatory struggle. In April this year, Cameroon completely banned the import of Starlink kits and suspended connection for the Elon Musk company, which was operating without authorization in the Central African country. Subscribers were consequently disconnected from Starlink services at the end of April. That's what's up in the tech world. Very well. Nzisa Kilu joins me now to speak about digital health records. And as you had me ask, that's a very, very typical Kenyan question right now. If you were told, gun on your head, remove that booklet, no, you don't have it. Nzisa, that's what we're here to talk about. Thank you so much for making time on TECHOVER. Just as I've asked, take us through the evolution of the healthcare records as we knew it back in the day, being written on manuscript in this booklet, which we can't trace right now, to where we are at and the other global markets that are, of course, fronting digital health records right now.
Yeah, so interestingly, many of you may not know, but the Digital Health Act was just signed this last month, and that's going to really drive a lot of innovation in the digital transformation of healthcare. But the journey, so if I take back my experience from the US, right? So we needed a catalyzing force. And our catalyzing force was what people call Obamacare, but really it's Affordable Care Act. And we needed to have insurance available to everyone globally or nationally at least. And what we had to do was make sure that all the providers could talk to each other and all the insurance companies could talk to the providers. For you to do that, you have to move away from doing paper records, right? So if I bring that now to Kenya, we're in a place where, during COVID, you saw people starting to embrace a lot of digital health. They are talking to their doctors over WhatsApp, over video. A lot of people knew now what an oximeter is. So if we want to try and help people understand how we go from paper to digitization, it's baby steps. We had the records on paper. If your doctor or your hospital gets a fire, there go your records, right? So as we look at how we want to improve wellness, we all have to be part of the journey. I like to say we're all moving towards more of a personalized care. We want to know what's going on with ourselves. We want to be a partner with the medical providers in improving our own lives. And the way for me to do that is to know where the data is and what the data is saying about me. I need to be able to say, hey, my oximeter is saying my oxygen is low. Let me go into a medical, let me go into a hospital and see what's going on. But even if we extend it further, I think we need to move into how do we bring down healthcare costs? How do we stop presenting to hospitals only for chronic care? How do we stop catastrophic care? We do that by finding ways to do remote monitoring, especially for chronic diseases, being able to capture vital signs, right? Periodically, every day, every other day. If you're a person who has diabetes, if you're a person who has hypertension, your monitoring of your vital signs is important because that data can then be fed into, I'd like to call it augmented intelligence. People call it AI, but I think in healthcare, it's more augmented intelligence. Your data, all your data points every day being loaded up to a system and your care providers being able to look at that data and seeing if you're deteriorating before your next visit and being able to create interventions early. So I think when I see the transformation from paper, I think it's very important for us to bring the patient along, for them to understand the why behind why we want to push for digitization of records.
Why is it important to have digital health records?
So when you think of keeping records, it's not, right now your records are in paper at your provider's hospital and very fragmented, and some papers are old. With time, some of the writing has expired. We're not asking for you to now keep the records in your home. No, we're saying let's put the records in a cloud, right? If you think of, let's give a more practical example, Netflix. I hope a few people who are watching this understand Netflix. You don't tell Netflix what you want to watch. It takes an inference of what you've watched historically to get an understanding of what you're interested in, and then it presents to you new information. So if you bring that into healthcare, there's all this historical data that we have about you that your doctor cannot actually synthesize and parse through, because a human cannot look at all that data to be able to say, you know what, this is a care plan for Brian in 2000. This is how he interacted with this medicine. Let's see what other care plan we can do. So we need to find a way to get all this historical data onto a platform in the cloud so that artificial intelligence and augmented intelligence can look at that data and come up with patterns, do spot matching for issues, and then be able to surface that to your care providers. Then your care providers partner with you on giving you better care. That's the why. If I take a more practical example, I like to say, and this was given to me when I started working at United Healthcare. This was my interview question. They said, imagine you are a diabetic patient and you go on holiday. So in Kenya, let's imagine you've gone up country and you have an episode. And your episode could just be you're either hyperglycemic or you're hypoglycemic, meaning your glucose is just off. Typically, you just need to get a glucose tablet. But because you don't have a record somewhere that can be interacted with, you will present to I'm Kamba, so I'm from Machakos. So you'll go to Machakos Hospital and you might sit in the emergency room going through a battery of tests. And you might actually die waiting for an intervention that could have been very easily deciphered from just saying, let me log into, of course, they are provider, so provider to provider access. My provider in Machakos can look at my records from Nairobi and see that I have diabetes, and that quickly can help them get to what exactly is the root of my issue and quickly get me glucose and I'm out the door. That could be the difference between living and dying, unfortunately, by not having access to what is going on about you as a person.
Which also brings me now to the question of the model of healthcare as it is. We're seeing a lot of resources being channeled towards facilities, or the government is launching $1 billion worth of a healthcare facility here. But the biggest problem right now is access and how to democratize these services to reach the people. What should we do, and how are other countries getting it right in terms of democratizing the healthcare services down to the people?
It's really a hybrid model. It's a partnership. I think it's a shared responsibility. And a lot of people think that the responsibility of wellness is on their care providers. No, the responsibility for wellness is on you, right? And you can become a better advocate for yourself by knowing what's going on with you. I think it's also important to understand when we talk about digital health is helpful in personalization of care, but in the example that you gave, we also need digital health to be able to help with procurement of even those machines that you're talking about. That is also digital health. Being able to have pharmacies be able to get, requests from from medical provider groups directly, and then send that medicine to you. That's also digital health. So I don't think we need to move away from thinking of it as a singularity. The patient is in the middle. The patient should always be in the middle. And then the healthcare system should kind of rotate around them. But we should also think about digital health supporting the administration side of health, which is, yes, we need the cancer hospitals. Yes, we need all those things. But we also need to remove the administrative burden on our providers by giving them digital tools. So digital health should help both the patient as well as the providers and everybody in between in that ecosystem. And I think when we look at it that way, there's so much opportunity for different players to plug into different aspects of the digital health system. From, as you mentioned, security, there's also procurement, there's making sure that we can support our medical providers as they provide care. You know, there's a lot of note-taking and a lot of, they say 50% of a nurse's day is spent on note-taking. We went and educated these people. They spent a lot of time and money educating themselves to go become note-takers. I believe if we take that burden away from them, we can put them to better use. And then if you think about even care being more democratized, right? If we have a digital health system that's national, now you've brought people in the mashinani into the equation. They all now can access the same level of digital support that everyone else can. So, yeah.
Health records, as we know them, are very, first of all, personal, heterogeneous. We could be having the same illness, for example, but the diagnostics, the characteristics, how they manifest are totally different. And now we have the AI bubble, which should be, of course, employed to assist in some of these things. Talk to us about the role of AI in analytics and in getting the right diagnostics, especially to ease the process of healthcare.
Sure. So when you think of, so I was talking about, I'm a big fan, and actually we have a company called Nia Uzima. So we're trying and tackle this space of how we can improve chronic disease management. That's a big part of the problem in the healthcare space. So when you think of your medical provider, we're putting a lot of stress on them to be able to take very little information and decipher a lot about what's going on with you. As you mentioned, you and I, let's take your example. Brian and Zisa each have diabetes, but very different. Maybe I have type 1, you have type 2, okay? So how I see it moving forward is we find a way to give you some ways of modalities, we call them. So it could be a pressure cuff, it could be an IoT machine that measures your A1C at home. Once you measure your A1C, that information should be pushed into a cloud. And all this data throughout the day. So I'll give you, I'll bring it down to home. I have a person in my family who has diabetes and hypertension both. And I watch them every day. They have a notebook. They're very diligent. They write their numbers on the notebook 3 times a day, but they see their care provider once every 3 months. So when they go to their doctor, they have a doctor and a dietitian, because some of the care is lifestyle as well as medical, right? So they go to their doctor, and the doctor looks at the beautiful data, 3 months worth of data. It's an hour-long appointment. Imagine how much stress and pressure you're putting on that doctor to parse through all that information and kind of be able to understand what's going on with Nzisa and her diabetes versus Brian and his diabetes. They can't capture all those different changes, number one. Number two, they can't tie back to a particular instance because it's maybe something that happened month 1 and now you're on month 3. Where AI comes in to help is all this data is being pushed to the cloud. And as I mentioned, your care providers, your nurses, your dietitians, your doctors, they're able to get notifications if you have an adverse, if you have a deterioration on your vital signs that are being pushed to the cloud. AI can say, hey, this is outside of the boundaries of what you told me to look for. Let's take a note on this. And then they can keep a closer look on that patient.
Kenya's tech space is really robust, and we've been heralded as one of the biggest places where the startup ecosystem is robust, and we're doing so well. The Communications Authority of Kenya released results of last year's mobile phone penetration, and they said that for the first time in history, they've seen quite a big surge in the number of uptake of smartphones as compared to feature phones. And in the first 6 months of 2024, Kenyans dropped 600,000 feature phones. What does this say about the future of digital health records in Kenya?
So I think it's been a very good advancement to do a lot of digital penetration. I think Kenya comes up a lot as one of the countries that's very tech forward. Of course, we know M-Pesa, we know all that. That's been a very catalyzing force towards getting us there. I believe that we need more players to get into the digital health space, and we need to educate our patients on the why we want to do digitization, help them understand how it benefits them. We have smartphones, feature phones in rural areas. That's great. That means you don't have to travel long distances to be able to access your doctor, right? But for that to happen, we need the systems to be in place in the provider space as well as on the patient side so that they can use WhatsApp. I talk to my family from San Francisco. I should easily be able to talk to my doctor, right? So that we can bring down the cost of care, bring down the churn, the toil of receiving care, especially in faraway places. When you have routine care, sometimes you don't have to go to the hospital. That brings down the cost of care. And when you bring down the cost of care, now we can provide more care to more people. I think that correlation sometimes is missed. Yes, we're bringing down the cost of care, but why? Right now, our doctors can't see enough patients, right? Because there's more patients than doctors. How do we balance that? As we become a bigger population, we are growing, said 2030, we're 19 and under, we're like a really big population. How do we manage that? We have to find a way to expand the care model by integrating some of these solutions.
Thank you so much for making time for us on TECHOVER. We really appreciate. I hope now you have a case to understand the importance of digital health records, and that we take a short break. We'll be back with more. Don't go too far. Very well then, welcome back to TECHOVER, the show that discusses all things technology and Africa's biggest tech conversation. Now, there's been a lot of fuss about this restaurant, and I'll tell you why. People are being served using robots, and no, they're not here to take your job. There's still a lot to go around for waiters, people in the hospitality industry where I trained in. And here then is the story of Robot Cafe, which is set up in Nairobi. Enjoy.
Welcome. It's lunchtime at the Robot Cafe in Nairobi's Kileleshwa suburb, and an unusual waitress is causing excitement.
Thank you, Nadia.
Nadia is one of 3 robot waitresses incorporated here to improve service delivery. This is a first in East Africa.
You assign them duties in the morning like normal waiters.
You tell them which tables one particular robot is supposed to go, or what is expected to do there. Because for instance, they do more than just survey. They sing happy birthday. For instance, let's say you do a reservation and you have a birthday. It's going to deliver you your cake with the message and everything, and also sing happy birthday with you with the background of waitresses.
Use of robotic technology in the food service industry is not new. Restaurants with robot waiters have opened in the United States, China, and other places. But the concept is new to Africa. Since opening in Nairobi 2 months ago, Robot Cafe staffers say the reception has been good, with the robots being the attraction for customers like Brooke Abito, who is here today with his family for lunch.
I was happy to show my kids this, in Africa, in your own backyard. So yeah, it was very good. You can see that the technology needs a bit of development, but it's really nice how the robots take the food, they come and serve you. And when I come back next time, I want to see the robots more interactive, taking your orders, bringing your food. But it's a very good first step.
Being my first time here and being served by a robot is something that I don't know if it's happening in most hotels in Kenya. So I came here to get the experience, and I can say everything is okay.
According to government data, the hospitality industry is one of the big sources of employment in Kenya. The introduction of robots in the sector brings fears of people being driven out of work by machines. However, industry experts like Edith Ojuang say there is no cause for alarm, as the technology will just serve as a tool to improve efficiency and quality of service delivery.
I really don't think it can face off the entire human labor, but it will be incorporated still, just like we have incorporated the other technology, and we've used it to improve our human labor and worked together.
Ojuang's advice is for Kenyan schools to incorporate technology training into their hospitality curriculum in readiness for the shift.
If we keep training people the traditional way, and by the time they're released in the industry, technology has already gone a notch higher. It becomes scary for them already, and it becomes difficult to be able to adopt.
I have to go pick the order because the robots can't. Secondly, the robots do not do the clearance. We personally do the clearance. Thirdly, the robots also do not cook, so it's the chefs and stuff. So yeah, there's a lot that the humans are doing that the robots can't.
Experts say the era of automated restaurants has finally begun in Africa, and diners should expect more integration of robots in their dining experiences.
What do you think about being served with a robot? That should be interesting, right? Yes. Interestingly, the first time I ever saw this was in Kiza restaurant in Dubai in 2021. We are getting it now. A lot of food for thought, but let's savor the moment, right? Tech tip of the week is up next, and then we close the show.
Hi there and welcome to this week's Tech Tip of the Week. If you're on TikTok, you've probably seen that there are now TikTok ads. So as a business, if you're looking for a way to advertise, you can try TikTok ads, and here's how they work. So first, you need to switch your account from a personal account to a business account. And you do this by going to Settings, click Account, then click Switch to Business Account. Once you do this, you'll now get access to the business suite. Now go ahead and click on it, and then you'll see this option written Promote. This option can take a few days to appear in your account, so just be patient. But once you have it, you can now run TikTok ads. So first, you have to have a few videos posted in your account. Then now you can be able to run those existing videos as ads. And you can customize these ads, for example, to get sales, and you can even put a landing page on that video. You can customize it to get leads so that people can call you or message you, or even just getting more followers and video views. And compared to other platforms, it is very affordable. You can start running ads from as low as $0.6 per day. And for this, you can get between 1,000 to 2,000 views. So the more you spend, the more views you can get, and it will be better to reach more people. So try it out, and maybe this is what you need for your business. That's it for this week. See you in the next season.
Very well, now you are up to speed with what's been happening in the tech world. You know why it's important to have a digital health record system, and you've experienced that robot cafe, robot restaurant. And that's a fair point to leave the show at. My name is Brian Jojotino. Always a pleasure seeing you and hearing from you. Keep being techie and make tech live forever.